So, good morning, everyone. Welcome to this wonderful session. My name is Lisa. I'm going to serve as your Zoom host. And in order to maximize our time together today, I'm just going to turn it over to our wonderful moderator. So please welcome with the Zoom features, the clapping, the celebration, all of that. So welcome, Kanika.
Good morning, everyone, and welcome to this session. I am so excited to see all of your faces, and some of them are like flashbacks from the past. At my time, when I was a student at Alverno College, I am a proud double Alverno alum. I earned my bachelor's degree and my master's degree from Alverno College, and I am currently in the inaugural class of the doctoral program at Alverno. So I cannot get enough of Alverno College. I am also a very proud principal in the city of Milwaukee at a charter network here, and I am honored to serve as your moderator with 3 worthy women who we are going to meet this morning. We are here to talk about the theme, Black Women in Access, Technology, Healthcare, Education, and Beyond. And this morning, Mira started us off, letting us know that it's time to move. And then Deanna Singh came in with our 3 questions for us to think about as we go through this day and when we leave this community conference. Who is at the table? What is happening at the table? And how to act while we're at the table. Now, these worthy women are definitely going to bring some insight to this particular theme that we have today. And I would like to introduce to all of you our first panelist, Miss Candice Hill. Ms. Candice Hill is a graduate of Alverno College. She graduated from the School of Nursing in 2016. She has worked in the city of Milwaukee and Chicago for their public health departments. And she is now early in the morning in the Bay Area, helping out with the vaccination efforts there. Good morning, Candice.
Good morning, everyone. I'm happy to be here. Nice to see everyone, and thank you for having me.
We also have on our panel this morning, Miss Angela Harris. Ms. Harris is the chairwoman of the Black Educators Caucus and has spent 20 years in early childhood education. And currently, she is working at Dr. Martin Luther King Jr. African Immersion School. Angela is an abolitionist educator who fights daily to create educational spaces where Black children are thriving. Good morning, Miss Angela Harris.
Good morning, everybody. Thank you all so much for having me this morning. I appreciate being able to hold this space with you all. I look forward to the conversation.
And our last panelist is Mira Story. Mira is in her 3rd year of nursing school at Alverno College and will be graduating in May of 2022. She currently works in the cardiac intensive care unit at St. Luke's Hospital as a certified nursing assistant. She has experience being a shift leader and trainer in a group home for adults with disabilities. She's a very hard worker and strives to be where she is today. She is a first-generation college student and is doing this to show her siblings the possibilities of being Black and being successful. She also wants to be a voice for her community and stop the inequalities in the healthcare system. Good morning, Mira Story, and welcome.
Good morning, everyone. This is my first time doing this, and I'm very grateful for this opportunity to be able to have a voice and to be a part of something like this. Thank you.
Well, thank you, ladies. And as we go through this, just remember that we started off with the words from India Ari, that we are worthy women. We are reflections of each other, and we are in this together. So Mira, your first time, relax. You have got this. And to Candice and Angela, I know that you are going to bring some great answers. To our guests, we do have some questions that have been prepared for our panelists that we are going to ask, but we also ask you to drop any questions that you may have as you hear the responses in the chat. so that we can come back to them throughout this session. Now, our first question, ladies. From your perspective, how is access to technology, healthcare, and/or education a civil liberties issue? And we will start off with Angela. Can you get us started on your response to that question?
Certainly. So I've really been thinking about this question a lot since, you all posed this question in the beginning. And I think for me, what comes up is like this interconnectedness of these three issues. And when I really think about it, out of the three, technology, healthcare, and education actually holds this space, right? Per our Constitution, that requires all children to be given an equal education, no matter what their race, ethnic background, religion, sex, whether they're rich or poor, whether they are citizens or not citizens. And so for me, like, the connectedness begins to happen in my mind based upon the quality of the educational experience our students receive. There was this study that I was able to read that was done by Jean Anion on social class and the hidden curriculum of work. And the study really breaks down like the way that children are exposed to school, the quality of education that they receive, the level of lessons and the type of style that they're taught in, and how that connects to the social class or the social caste structure that exists in our society, the social caste system that exists in our society. So children who attend schools in historically divested communities like mine will likely end up being disproportionately represented in the prison industrial complex. They will likely end up battling homelessness and or working low wage employment because of the access to resources, the way that our lessons are taught to our students. Those are all determinants, right, of how they're going to progress in life. And so when we think about like low wage employment, right, these jobs often lack access to affordable health care or health insurance at all. And so, that limits access to people being able to actually receive quality health care. Prior to my time as a teacher, I worked for Head Start as a family worker. And so my role was to assist and work with the whole family. And one of the major things that I always had to do was assist families with issues related to health, vision, and dental care. And so this really stemmed from either them not having insurance at all or them having state issued insurance. And so, I saw firsthand them waiting for months to get an appointment because of the limited number of providers available on state issued insurance. I've listened to them share stories with me about how their symptoms aren't believed, or they're often misdiagnosed, or they're just simply rushed through the process because the provider has an overwhelming number of patients to see at these clinics. And now when we think about this pandemic, right, all of these inequities and struggles and access that existed before are exasperated. Access to education is now tied directly to your ability to be able to access technology. And if you can't access technology, then you can't participate in the educational space. And so like I would argue, like, if education is truly this civil liberty, right, that has been provided in the Constitution, we would ensure equal actually meant equal. Because when we don't do that, it isn't just the academic outcomes of our students that are affected, it's the life outcomes of our students and their families that are ultimately affected by that.
And Ms. Harris, you pointed on several issues and topics. You talked about education being this space that holds everything, right? And the quality education impacts the access that you have. And you brought up what technology, having it or not having it, and its impact on education. Mira and Candice, can you speak to, particularly Mira, your experience as a student, a nursing student, going through this pandemic right now, and how you are confronting just some injustices that may exist as you are moving through being a student and eventually becoming a nurse?
I think right now it's very hard. I'm blessed enough to have access to technology and having to have Wi-Fi, but it's like those who don't, what are they supposed to do? I feel like with the pandemic, everything is going up. Not everyone is able to afford these things. Some schools are offering, some schools are not. Um, then we also have the issue of who do we decide gets to have these resources? Some schools, are offering even with middle school and elementary, but then they're kind of iffy about it because they think with certain communities, they're not going to receive their things back or they're going to be broken. So then with that aspect, then what are these students supposed to do? They're at home, they want to learn. It's already hard for us being online, sitting online for hours. One of my classes are 4 hours. We get maybe one break and it's about 20 minutes or so. Sometimes not even that. It's a lot on students. And I feel like it's a lot on the parents as well because they have to work more because they're trying to be able to afford these things. But at the same time, who's going to watch these kids while they're at home?
Mm-hmm.
So I feel like this has been a very huge issue and it has affected me as well. And I think that we have the resources, but they're just not being utilized. They're not being offered to everyone. And I think that is a huge issue because we all want to learn. Like myself, I'm pushing through it. This has been the hardest semester I've been through with COVID. I myself was admitted in the hospital for COVID. So it's like a very big issue. And I think that things need to change with this.
And hearing from a student perspective, you are a college student speaking about just the difficulty of being a student. Ms. Harris is a classroom teacher experiencing what it's like to be a classroom teacher with even our youngest population of trying to deal with the automatic change of school when this pandemic hit. It hit us all very hard. And Mira, you brought up parents in this whole scenario that we did not initially talk about. Candice, many of the parents of the students that we serve or the students that we are the ones going to get vaccines right now. How are you experiencing any injustices? What are you hearing from the patients that you see?
Yeah, so with the vaccine effort, there were, from my perspective as a public health nurse in Chicago, when I observed the rollout of that, I did notice there was a lot of disparities. For instance, a lot of the vaccine sites were in areas that were not servicing people of color necessarily. And then also I noticed that to sign up initially for the vaccine, there were issues with technology. It wasn't clear how to get a vaccine appointment. And people, as the other ladies noted, with better access to Wi-Fi or technology had the advantage. So then I know in Chicago, you saw the differences and the rates of vaccines with the different races. And in the beginning, it wasn't very equal. So the city of Chicago definitely put in a lot of work to focus on that issue. So access is one, but also just information and knowing that people are confident in their decision to get the vaccine. Obviously, we are in the legacy of things like Tuskegee. Black people have more negative experiences with healthcare, and all those things definitely inform our decisions. So when I was getting vaccines, it was a lot of health teaching. I was very calm and I explained, what each vaccine did and the efficacy and things like that, side effects. And sometimes it just takes someone being patient with someone, listening to their concerns to help with that. But overall, I think things are improving. I think the last study that came out said that actually vaccine hesitancy with Black people were actually at the same as whites. So I know in the beginning, there's a lot of things about that, but those concerns are totally valid. And I think as healthcare providers like myself, doctors and nurses, we need to continue making sure people have proper access, making things more fair, and then also listening to those concerns in a non-judgmental way.
And so, Candice, you are leading us right into kind of our next question around what systemic changes are needed and why. And you started out with just having an open ear and listening to concerns. When the vaccines became available, as an educator, I was on the edge of my seat, just waiting for, when is it going to be the time for me to receive the vaccine? However, on the other side, I was on the edge of my seat, like, when? But then I was like, what impact is this vaccine going to have on me? And my grandparents are 93 years old, and my parents are closer to 70. And so they had that opportunity first. And so aside from listening, our community is also watching. So I watched my grandparents go and get the vaccine, and I watched my parents get the vaccine and how it impacted them. And so that made that calm in me settle in to be able to go and get my vaccine. And a lot of people are saying different things. You're getting different messages about receiving the vaccine. Should you get it? Should you not get it? What happens? Candice, I'm going to give you some time to just reflect on this and think about what are some systemic changes that are needed with communicating to our community, but also connecting into the world of education, or how is technology utilized? I am going to, while you're thinking about that, Mira, I'm going to lean into you as a college student and hearing everything that is going on related to the pandemic. What are some systemic changes that you think are necessary for just students from the college level, possibly on down, about understanding what is going on right now?
I think for us to kind of, and I think most of us kind of do understand, but I feel like I see some of my peers, but us being young, they want to still go out and do the things that they used to do. They're not taking it as serious as some should. Like a few of my peers, once they found out how sick I was, with me not even going anywhere, to my dorm, to school, and back, how sick I got just from that, they kind of felt like, oh wow, we need to, kind of settle down, get our vaccines, go from there. But even with the talk of the vaccine, I feel like we didn't know as much. Even with us being nursing students, we didn't know much about the vaccines. We knew our background, we knew how it's going to, have an immune response. We knew that type of things, but we didn't know exactly what was going on with these vaccines. And I think that was an issue too, because a lot of us were like, oh no, we're not getting that. That was made way too fast. Like, we don't know what's going on with that. And I think that's within our community as well. They didn't want to get the shot. How did this COVID vaccine come about already? We don't know what's in that. Why should we get it? It's affecting our community the most, but we're the one that's more resilient to it because we don't know, we don't understand. And I feel like once with my own family, once I started explaining it to them, it made them actually want to go and get the vaccine, which they have been vaccinated. Also, it was like an article in the news. It was like a doctor really explaining, sitting down and explaining it. And I think that helps. So I feel within every community, there should be a voice, someone explaining these to them, even if it's someone who does not speak English. They should have someone who can explain these things to them to make them want to go out and do what they need to do to be safe, because there's no reason why we should not all be able to be safe just because we do not understand something.
Mira, I want to ask you a follow-up question. You talked about there should be a voice, and that you talked to your family and your friends were able to go through an experience with you. If you had to give them a message, or give those who are still on the fence a message, what would that message be about living in this time?
I would think with the message with living in this time would be is to continue to stay safe, continue
Mhm.
to stay updated on the regulations, which is hard because things are changing. I come to work almost every week and there's something new going on. So it's hard, but we have to put in an extra effort to understand and keep up updated on things. And I think that we also have to stop being so mistrust within the healthcare system. I know why we have this mistrust, but we
Mhm.
kind of have to get out of that because that's the only way we're going to be safe is if we push through and actually listen to what is being told to us.
Okay. Thank you, Mira. Now, Candice, I'm going to come back to you. Mira said, we have to push through.
Mhm.
As working in the healthcare field, what are some changes that need to be made and why? And what are you messaging to help us push
Mhm.
through?
Yeah, I think at the core of public health messaging, it is really meeting people where they are, and also understanding the unique needs of the community. Like you said earlier, you saw your older relatives get the vaccine, and that influenced your perspective on getting it. I think people need to understand the power of, Black grandmothers, Black aunts, how their perspectives and their wisdom do play an integral role in the family and what decisions we make. I think, going back to meeting people where they are, with some of the public health campaigns, utilizing the Black church, Black community centers, even Black barber shops, because if the issue is a lack of trust, then we need to lean on who does the Black community tend to trust? We tend to trust, our circles, our family members. And I think, structurally, that would be that would probably help improve some things, not all of it.
Mhm.
But I've just noticed that from the public health messaging perspective, overall, the vaccine came out very quickly and it was hard to sort of do studies and do focus groups as you normally would do for these types of things. Um, but at my last job, we did talk about these things freely and we were able to give our perspectives. And our team, the team I was working on understood those things. And so me at least saying that to the people around me is a way that I can start. But structurally, a lot of our health departments, things like that, and hospitals, they need to start considering like, Black people, we have very unique needs and things like that, and drawing in our family members more.
Thank you, Candice. You talked about meeting people where they are, that the community watches, they listen, they see what's happening to their families and friends, oftentimes before they respond. And that is the same thing with going back to school. And so even as schools open up across the city of Milwaukee, some schools have been open since August. You had other schools that opened in January. Most recently, Milwaukee Public Schools opened their doors in a structured way to have students come back in. Um, Now lifting up, Ms. Harris, your voice from the education perspective, what are some systemic changes that are needed within the world of education to help us continue to educate our future during a pandemic?
Um, I will get to that question in 1 second. I just really want to thank Candice for her perspective. I really appreciate thinking about meeting people where they are, especially in terms of allowing them to process information, right, in a time that's comfortable for them. I think particularly when we think about Milwaukee and COVID-19, when we think about Milwaukee County and how Black folks represent, I think maybe about 27% of Milwaukee County, but made up 42% of, positive COVID-19 cases. That means that Black folks likely had someone in their family that was exposed to COVID-19. And I think that that's a very real reality for my students. I have several students in my classroom who have had family members who have had COVID-19. And so I think ultimately a lot of the decision making that happened around whether or not to get the vaccine really came from their personal and shared and lived experiences. So Candice, thank you for sharing that. I think when it comes to systemic changes in public education, I couldn't consider myself an abolitionist teacher teacher without saying that the system as it stands needs to be destroyed and we need to build something new. We are trying to educate and reform a system that wasn't created with Black and brown children in mind. And so when we do that, that means that we're always going to be playing catch up. And so I really think it's about creating something that services the most marginalized students. When we're talking about our students, we need to be thinking about those students that check all of those boxes for marginalization, right? Like those students who have special needs or some sort of disability, those students of color, those students that are non-gender conforming, our LGBTQ plus students, right? And our system isn't prepared to properly educate those those students based upon the realities that we see playing out in front of us every day, the disproportionate proportionality and suspension rates for Black and brown boys and girls, the low academic achievement for Black students, even Black students that are in upper middle class families and attend well-resourced, well-supported suburban schools still perform worse than poor white children. And so like these are the realities of this system. And so the only way to really create the change is to completely demolish it. I think, that is a large goal and an overarching dream. I think short term, we need to encourage parent advocacy. I think that bringing parents into the fold and first of all, educating them on how to be advocates for the type of educational spaces they want to see their students in, and then giving them space to advocate for themselves is one of the ways that we could intentionally begin to create incremental changes in a system that needs to be upended.
You raised having parent advocates, educating our parents from all aspects, from the health fields, from education. Do you feel that right now, where we are now in April, we have gone through a year. When March 13th came, many people said this was the day last year when our lives changed. This was the day when we thought we were going to be out of work or maybe out of school for maybe a week. And it turned for some people into a year. Do you think when you talk about parents, and again, Angela, I want you to speak to this from your perspective, the expectations that schools have on children, do you think that schools thought about the impact of this pandemic on parents and how that impacted their children's access to education?
I think that parents are, as a parent myself of students who attend public education here in Milwaukee, I think that often we are the last thought, right? We want to center the students and we want to center the needs of our students, but I think that it was particularly important during this pandemic to really think about its collective impact. So if I'm not sending my children to school, and I think maybe it was Mira who brought it up earlier, access to childcare, right? That is a huge issue for families. And so families were forced to pivot and try to find alternatives to childcare, particularly during that month of March when we were under the Safer at Home order. And so we also then placed this expectation upon parents to then become educators when they weren't even fully aware or fully sure on how to do that and how to best service their students. And, for me, I really would have loved to see a comprehensive plan that included parent outreach prior to us starting virtual learning and really allowing parents to understand how to navigate the different platforms that we were going to be encouraging their scholars to use. I really think that we should have incorporated parent voice, right? And allow parents to tell us what they needed in those moments to make them feel successful in what they were doing. And so I guess just the short answer to your question is no. I think that parent voice is something that is sorely missing in educational spaces, and really allowing, like I said, when we think about the most marginalized students, we also need to think about the most marginalized families. like our homeless and transient families, particularly when we talk about access to technology. If I'm constantly moving around and I leave my my hotspot at the last shelter that I was at, now what am I going to do for the next time? And so like there are all of these components I think that could have really been addressed and maybe would have made the stress for parents and families a little bit less.
In our opening session, we heard from Deanna, and she talked about who's at the table. And this is going to be a question for our panelists, but also our guests in this session. I want you to get your fingers ready and type something in the chat for me if you could respond to this question. Who needs to consistently be at the table as we make decisions about healthcare and education during this pandemic? So that is the question. Who consistently needs to be at the table as we make decisions about healthcare and education in this pandemic? Now, those of you who are guests, I want you to drop some of your ideas in the chat. Who needs to be at the table? We keep hearing different things. There are some voices that we haven't heard. Angela brought up parents. Yes, the children. Absolutely. Caregivers. Okay, so beyond parents, what about grandparents? What about teachers who are playing that role of being a classroom teacher? So they're caregivers to their young people, but they may also have families. Pediatricians, thank you, mothers. Okay, representing every single community. Ms. Harris began to talk about the different communities that we need to make sure have a voice. As you are looking at the things that are in the chat, Mira, Candice, Angela, anyone else? Who else needs to be at the table when we are having these conversations?
Yes, absolutely. Agreeing with all of the points that are said here. But also, yeah, just thinking of it as who is being underserved consistently, whose voice is not being listened to. And I think it's really important in the realm of healthcare that not only are we being represented, but we are also holding people accountable in that system. So, you know, there is a huge issue with anti-Black racism in healthcare. I mean, they've done so many studies. If you look back at the Black infant maternal mortality rates, how, you know, Black women tend to have worse outcomes than their white counterparts, you know, 3 to 4 times more likely to have a severe negative experience after giving birth or a complication. And so partly that is access, you know, lack of access, but also when a Black woman comes to the ER and she reports pain or says this, you know, is bothering her or anything like that, is she being listened to? And when she's not, what is happening? How is that being resolved? And I think it's really important for us to also like confront those issues. And either it's through education, you know, while medical students or nursing students are in school, if they could be taught about, you know, unconscious bias and, you know, practices in the medical system that sort of have been around for years that we never really questioned, but are deeply rooted in racism. It's calling out instances where you have that negative experience and you're not listened to, or your family member isn't listened to, and knowing that you have rights as a patient to be respected and listened to, and you can, you have the right to report something that happened to you negatively and you feel like your needs weren't met. So I think it's a two-way street of representation, but also accountability. And I just wanted to bring that up.
That accountability piece, you said something, the right to report. Oftentimes things happen to those who are in marginalized communities and they don't say anything. It becomes emotion, it becomes anger, it becomes, you know what, I'm not going back to the doctor. or I am not going back to wherever the negative was experienced. And it might be the very place that we may need. So reporting, empowering that voice. How do we do that? And I want to bring in Mira, bringing in your voice. How do you feel empowered to speak up when things are not okay, when you are feeling uncomfortable? How do you feel empowered to speak up?
I feel that it's very hard to speak up. You're afraid that if you do speak up, then something negatively is going to happen towards you, or your care is going to be worse, or they're not going to do everything you want them or need them to do. So I think that is an issue within myself. I spoke up within my care. I went through a lot when I was hospitalized, so I had to speak up. I also had to report the doctor. It was a lot that went on within the system, but I advocated for myself and I pushed. But not everyone is vocal enough to do that.
Mhm.
So we have to make it within the healthcare system. We have to make it that it is okay to report things. We don't say that to our patients, like, oh, if this and that happened to you, maybe you should report it. No one tells you that. You have people don't even know that this is a thing or who to report it to. They think just telling the nurse is, they did something about it. But no, there's actually someone higher up that you can report these things to and actually get something done. So I think that we need to kind of vocalize that these are ways that you can report things. But we also have to, within the healthcare system, make sure that it is okay for them to report negative things that are happening to them without them feeling like something's going to happen within their care.
And Mira, you made me think about how do people know how to report? And Candice, you brought up reporting, and I know Angela, within education, we often tell parents and scholars to speak up and say something. I think we have the power of technology to be able to really educate people on how to do that. We say do it, but how do you do it? Who do you talk to? Mary, you talked about there's someone higher, there is someone above. Are there systems in place to report things where you don't feel like there's going to be retaliation because I spoke my truth and my opinion? And often we are told to, sometimes get comfortable with being uncomfortable in situations. If I'm uncomfortable, somebody is going to be uncomfortable around me because I have to speak up for me. We have to advocate for who we are. Parents, health practitioners, advocating for their children, their patients, teachers doing the same thing. But also, as Deanna mentioned earlier, the way that she taught her children to speak up for themselves. We have a lot of work to do in our community to teach each other that it's okay to speak up, that Brene Brown talks about kind, being clear. Being clear is kind. So if we're not giving clear messages to our doctors, to our nurses, to our teachers, to school principals, then how are our needs going to be met? And that is something that we have to think about around systems. How do we get that out there? Is that a text message? Is it an email? Is it something on social media to say it's okay to speak up and speak out, because that's where the change happens? Now, I do have another question for all three of you ladies. What is one piece of advice or encouragement you would like our listeners to take away from the discussion that we've had thus far? One piece of advice or encouragement that you would want our listeners to take away from the discussion thus far. And we are going to start with Angela.
So I think, the one piece of advice that I want folks to take away with today is to continue to rebuild these relationships. I think that what we are hearing, what people are talking about, especially when we talk about fear of retaliation for advocating for yourself, is really a lack of trust in these systems, because the systems have failed us before. I think that has been pointed out several times today, the way that the systems fail us. So continuing to rebuild these relationships through having conversations like this, through making space at tables for folks who typically don't sit at those tables. I also think that it's important for the gatekeepers at those tables to begin to lead from behind and allow those who are most marginalized by limited access to healthcare, by unequal education, are really the ones that are setting the platform and determining what's best for them in those spaces. And I think that the encouragement is just this space in general, right? To have Black women, for Black women, leading this and being a part of this conversation. You wouldn't always see something like this happen, particularly when it relates to education, which can be highly enthralled in academia and very white. And the same thing with education. So being able to have these kind of conversations and pulling in more folks who are part of these marginalized communities is definitely encouraging.
Okay. You talked about gatekeepers leading from behind. Speak to that a little bit more. What does that mean, leading from behind?
So that means ultimately allowing the folks who are affected the most by whatever the situation is, allowing them to take the leadership and what the solutions are going to be for their communities, right? I think we have these gatekeepers at the table and they're like, that sounds like a great idea, but now I want to do XYZ. And they never really take into consideration what people are telling them and what people are asking for. And so as a person, like when I look at what leadership from behind would be, it really is about allowing these people to have space to create their own solutions, and those gatekeepers just giving them the money, the policies, or the platforms to allow them to do that.
I'm hearing empowerment. I'm hearing lifting up voices that aren't actually heard. And then you said something very little, but very important. That financial piece is extremely important. Gatekeepers, community leaders, those that have access to resources that others may not know about, being transparent about what is available. Absolutely, Ms. Harris. Mira, what piece of advice or encouragement would you give to our listeners today?
I think just taking in what we are actually saying. So don't just leave this meeting and forget everything that was said. Don't just throw it under the bus when you do see these inequalities going on. Be a voice, actually listen to what is being said. I had a professor come in to one of my clinical sites and they wanted to hear what was going on our site. They wanted us to verbalize these things. We're at the point of, why do we continue to verbalize what is going on if there's not going to be a change, if we're not going to be advocated for, if we're going to just be thrown under the bus at the end of the day? So with that, I'm saying to please take in what we are saying. Please educate yourselves on what is going on. Think before you speak on certain things. And think about these communities when you are thinking about certain things, because we don't all have access to these things or we don't have the knowledge. So I think that just taking that time to just listen, educate yourselves, and actually being an advocate will be a great thing. And that will make a huge change within things that are going on.
Mira, you said think before you speak. What do you mean by think before you speak? I think I know what you mean, but kind of explain that a little more. You talked about I'm being thrown under the bus, or we say something and nothing happens. When you said that phrase, think before you speak, what did you mean by that?
with think before you speak, meaning in terms of the way you talk about a community. Think before you say certain things. People have said things to me like, "Oh, you're very intelligent." Like, oh, like it's a surprise that I'm pushing and I'm doing the things that I'm doing because of my skin color. So I think that with that, we need to think before we say things to people. Think about how you would feel if someone said these things to you. How would you feel if this was your community going through these things? Actually think and take in what you are saying. Think about it before you say it. Remotely, just constantly think, because things that you can say can impact people in a very, very hard way.
Listening to you, like the thought of microaggressions popped up right away. The thought of perpetuating stereotypes or assumptions popped up right away. You talked about the way that you talk about a community or to a community. Are you engaging with the community? Are you trying to do something to the community without including them? Is there a sense of I know best versus talking to the community? So Mira, again, you and Angela were on the same page of empowering the people that are most impacted, giving them the tools, the knowledge, the resources to be able to move through this. And it is difficult to say to move successfully through this pandemic, but to move through this pandemic with the knowledge to make informed decisions that are best for the individual and best for families. Candice, lift up your voice, and what is a piece of advice and or encouragement that you would give to our listeners today?
Yeah, I would say there's two things I was going to say specifically to allies and advocates who are trying to be better. Really think about and reflect on how you yourself or your immediate community perpetuates anti-Blackness and racism that adds to these structural problems. I think that's really important to do that reflective work so you can properly support, other marginalized groups in their issues. I think that's kind of hard to do for some people, but it's a really important first step. Otherwise, I think it's not genuine advocacy if you are not doing that. And then for, all the other Black women here who see these issues and can be overwhelmed by them that we faced. One thing something that's comforted me was that, we are very resilient people and very resourceful, and we've overcome a lot. And so these problems that we face, they're not really, they don't speak to a weakness that we have. We're living in a system that is inherently unfair to us. And when we remember our strengths and remember the legacy that we come from, and know like in the past, we've overcome these issues before, and tapping into our history, I think that's really important in staying positive and not feeling hopeless. Because it can be very overwhelming the more you think about and study these problems, and very frustrating too. But just try to know that we've overcome a lot and we can overcome these things as well.
Thank you, Candice. We heard the words today: process, pivot, push. I would like to add the word press. We have to keep moving forward. Candice reminded us that Black women historically are resilient, are resourceful. What do we have to go through to maintain that resilience? What's under the smiles that you see from our panelists? What's under all that you may outwardly see? What's happening inside of us? And when you think about what's happening inside of us as Black women, as your presenters today, what's happening inside of the Black community? What you see may not always be the truth, may not always be the reality. How are you going to serve as advocates, allies, some even say as co-conspirators, to stand side by side with the community to make changes within education, within healthcare, within even technology and access to make sure that we move closer and closer to being equitable to all of the communities that are impacted by this pandemic, especially those that are most marginalized. Now, Nat, I do not know if there were any questions from our listeners during this time, but if there were, are there any that we can lift up and have our panelists respond to?
Yeah, so I just posted a
Okay.
request to the audience to post any questions. We do have one. Let me just pull it up here, which is, it's inspired by something that Mira said, but I think it can be broadened to everybody. How are we training or not training our healthcare and education and other service workers about patient and student and family rights? Do you have any perspective on that? Did it come up in your training, your coursework, et cetera?
I personally don't think it is in our training. We more so, I think, with social media, we're understanding that there are more things. We understand more so not to come in there as biased, but we're not actually being taught these type of things. We're not taught how to work with different communities. There's classes for it, but we somehow don't end up talking about individual cultures. We're more so focused on the norm, and that's not realistic. I see different cultures on the floor I work on all the time where I have to use an interpreter. You know, some cultures you can't make eye contact with them. With us, eye contact is a good thing. So I feel that no, we're not properly trained on these things, and you can't be trained on everything because there is a lot. But the bare minimum, I think we should be trained on, but we're not. So as we go, I know me personally, I started young. I started when I was in high school working um, as a shift lead in a group home with disabilities. So I could learn these things. They all had different disabilities. So I knew I had to work with them differently. So, but everyone doesn't have that aspect. Everyone doesn't have that type of training or background. I personally, work through these things. I try to learn more. I try to be um, a voice for anyone, any patient, but not everyone has that. How should I put that? Everyone doesn't have that a thrill or that drive to do these type of things.
Mira, you talked about that drive that comes from within. That's your passion to be able to support everyone. So when you encounter something different, you take the time to learn things. You take the time to ask questions. How I'm going to shift a little over to Angela as we talk about these rights, patient rights. What about student and family rights? As a classroom teacher, Angela, how are you making sure that students and families know their rights, just as Mira is building those relationships so that her patients may eventually know their rights as well? How are you doing that in the classroom?
So there's two things I want to talk about. I think that when we particularly think about the field of education and the field of healthcare, we represent occupations that probably deal with the most diverse population of our society, right? We see everyone, we have to service everyone. And so I think it's so important in those fields in particular for students to be introduced to implicit bias and anti-racism practices in their pre-certification, in the pre-certification phases of their training, right? When I think about the way that I particularly make space for parents and students to know their rights, it's really what Mira said. It's those one-on-one conversations. It's informing myself so that I can better inform them, and just giving them the tools that they need to have in order to be able to actively advocate for themselves. But I think that, particularly when it comes to teachers, we are often seen as the folks who know everything about educational spaces, right? And so that ultimately, for me, pushes out parent advocacy, because it's like, oh, the teachers know best. But really, the parents know a little bit more than us, I think, when it comes to their students and what their students need to actually be successful. So I think that is it's a two-pronged thing, right? Like, we have to give parents the information, but we also have to be willing to let go of some of that control as educators too, of that idea that we know everything about this educational space.
Mm-hmm, mm-hmm. Thank you, Angela. You talked about, and I'm going to tie this into patience as well, giving parents, students, patients information, but also letting go of control. We are professionals in our fields, but we are not the experts per se of the people that are in front of us. They are telling us what they need and what they want and desire. Ladies, this has been a fantastic morning. Thank you for your words, your perspectives, your insights. You put thoughts and ideas on all of our minds. And as our poet said this morning, it's time to move. It is time to really reflect on who's at the table and how are we inviting other voices that are not always at the table. To our guests today, thank you for engaging and putting your own feedback and responses in the chat. There is an evaluation form that has been dropped in the chat. If you can take this last minute to go ahead and click on that evaluation and complete it. And we absolutely hope that you continue on into a next session today and continue to remain engaged and be an ally and an advocate for those in our community who are not yet ready to advocate for themselves. Thank you, everyone.